All right. All right. Hey, everybody. It looks like we are live. I never know when these things turn on. So, here we are. I hope everybody is having a good Saturday. We're all the way into August, and I can't believe that we're this far into the year. So, some schools have started back. I know the public schools here in Starkville are getting ready to go back this week, and they're doing a combination of virtual and traditional learning. So it's going to be an interesting few weeks as everybody kind of learns how to adjust to those new norms and new routines that we're having to create. So today I'm going to talk about some questions that I've gotten through Facebook, some questions that some other people have asked, and then just common things that I've encountered with my patients over the last several weeks. I know I've kind of been on a little bit of a break from as much social media just to give myself a little bit more time to rest and have downtime at the end of the day and spare time for me, which is important, I think, for everybody. So I'm going to start with the questions and then go through and kind of give a summary of some of the things that I've talked about before, just as reminders. And if you guys have questions as we go along, you just write those in the comments and we'll answer them together. So, one question, one of the first ones that I got was about flu shots and when we should be getting those this year. So, traditionally, flu shots we say you should get definitely starting in October. And that really starts the flu season, which typically goes from September, October, all the way into March and sometimes even into April. And so, our normal recommendation and what I typically tell patients is to definitely start getting your flu shots in October. This year, we're in a little bit of a different situation. So, the fact that we have one virus that's a novel thing that's caused our pandemic that we are still in complicates the flu season because we certainly are probably going to see people that have co infection with flu and coronavirus. So, the flu shot being something that can help prevent the flu and that aspect or prevent the severity of illness that people may get when they do get the flu is going to be really important. So if we can prevent that, then that's going to be one really important aspect for the fall and the flu season as we go forward. A few myths about the flu shot that I'll touch on just because I know there is a lot of kind of question and sometimes fear about getting a flu shot in particular. Flu shots are very safe. There's no chance that getting the flu shot is going to give you the flu. A lot of that comes from the fact that we're giving the flu shot in the middle of flu season. And so if you get the flu shot and a couple of days later get the flu, that's more than likely because you were already exposed to it right around the same time that you got the flu shot. So they're very safe. They sometimes are maybe not as effective from year to year. So some people feel like they don't work that well. But in general, we know that flu shots work well. But we also know that if you get a flu shot and then you get the flu later, that you're less likely to require hospitalization and develop complications from the flu. So that's another really good reason you may still end up getting the flu at some point, but 9 times out of 10, you're going to get much less sick and be much less likely to have to go into the hospital because of the flu. So this year, we're encouraging people to start getting flu shots kind of as early as you can. I'm going to target for sometime in September or the beginning of October for mine personally. My clinic doesn't have our stock of flu shots in yet, but we expect that we'll be getting those probably sometime in September. And so that's one really important thing is to go ahead and get your flu shot as soon as you're able to. The next question that I got was one about the vitamins and supplements that you can take to help boost your immune system or specifically to help prevent COVID infection. So the most common ones that we're hearing about and have heard about from the beginning are probably zinc and vitamin C. And so those vitamins specifically we know have important functions in the immune system and how our immune cells function and help us fight off many different types of infections. So they can be useful. When we look at supplements in general, it's really difficult to determine the true benefit that they have. So we're learning now that things that we don't have a lot of studied information or true data on is a little bit difficult for us to say one way or the other with certainty how helpful or how harmful something like that may be. So this applies pretty widely to the world of vitamins and supplements because we just don't have the large volume of data and studies that we would like to have to be able to say how effective one thing is or how safe things are. They've certainly been around for a long time, and so we know for the most part that all of these vitamins and supplements, especially zinc and vitamin C, are ones that are more than likely helpful and probably not going to be harmful. So those things, I've taken them periodically during the pandemic just to kind of help keep my immune system up. And so those are ones that I think would certainly be okay for you to take. You definitely don't want to go over the recommended daily amount of those, but I think they're certainly safe to take and more than likely will be helpful in some part. Vitamin D is another vitamin that I got questioned about, and there's been a lot of studies up and down, back and forth over the years of the effectiveness of vitamin D. Similarly, in general, we don't think that it's going to be harmful. More than likely, it's going to be helpful in various ways, especially bone health. That's probably the most common reason that we recommend it, especially for individuals in the older population. Certainly, as we get into winter, we're not going to have as much sun. It's a little bit different for us here in the South because we usually see the sun a little bit longer. So that's a great source of vitamin D, but certainly a low supplement on a daily basis would more than likely be helpful and certainly probably not harmful as long as you take the recommended amounts. A few other things on the topic of the immune system that can be helpful are kind of the basic things that I think a lot of us know, but we may not always be as good at practicing as we think we should or we would like to be. So your diet can be very important. So you want to make sure that you're getting a healthy, balanced diet. I always recommend a low fat and low carb diet for my patients just because that's kind of a balance of everything. You want to get good nutrients and you want to have good appropriate portion sizes, so not overeating too much. You want to make sure you have a good balance of protein and vegetables and all those things. So that's one aspect, a healthy diet. Along with that goes with your water intake. So this is my water intake for the day. I'm a little bit behind, but this is my big 8 ounce glasses, 64 ounces for 2 liters in a day that I'm targeting. And I will tell you, I have definitely seen a difference since I've been drinking that much water on a daily basis. So I think that can be really helpful and plays probably a much bigger role than we think it does in how we feel and how our bodies can respond and change and fight things like infection or fatigue and things like that. So water is very important. So make sure you keep up and set good goals for that. And then the other thing, sleep is very important to your immune system. So having downtime that your body can recover and repair things that are needed to keep up your immune system and keep you healthy and feeling well are also very important. So those things, sleep, good water intake, good diet, and then your vitamins and stuff can also be helpful for the immune system as well. So a few other things that I haven't gotten specific questions about, but I'm certainly seeing a large number of patients in my clinic have some questions or problems with this. Something that we're seeing, I think, very widespread, and I've talked about before, is the mental health aspect of all this. So we are, almost 8 months into a pandemic where our lives have all been turned upside down and we're having to do every single thing that we do differently. That's been very stressful and it's difficult to cope with that. Things are changing on a really regular basis and that can be really overwhelming to deal with. People are worried about getting sick or worried about their family members getting sick. They're worried about, a lot of other things, kids going back to school, going to the grocery store, how you're going to manage your work and all kinds of things. So there's a lot of stress and everybody's stress comes from different places, but if you're stressed and you're feeling anxious or you're feeling down and depressed, that's completely normal and completely understandable. You're definitely not alone. So there's some gradation and variation in that level of stress and anxiety. So there's certainly things that you can do, exercise and good self-care, things like meditation or reading, journaling, doing your hobby activities that you like to do that you can do at home and still be safe, that can be helpful. But there are a lot of people that it's just become so overwhelming that medication may be a good option. And that's not something that you should be scared to approach your doctor about or ask for help with, because it's something that's really common and I'm seeing a lot of it. And so there's definitely things that you can do and ways that your healthcare providers can help you. So I really encourage you to reach out to your primary care provider if you are having problems with that, emotional stresses or anxiety or depression or those kinds of things, and be an advocate for yourself in that realm of your life. The one thing that I will say that I've started to do, and I'll give a shout out to my girlfriends Hannah and Audrey and Sarah and Anna. We started early on doing a gratitude list every day, and so we all share at least 3 things that were positive or things that we were thankful for, that happened that day. And that's been something that we've kind of kept each other accountable for, and it's been really helpful for us to see kind of the positive aspects in our day, even when we don't have a good day, and we can say that we just had a good dinner, or we can say we took 5 minutes to do something for ourselves. Even finding the small things that are positive can be really important. So that's a good thing to do as well. Touching on going back to school, that's another big topic. You know, we had students come back to Mississippi State this week, and that's been a little bit of an adjustment, I think, for a lot of people here in Starkville, a lot of the students, the professors, and everything. And then the public schools are going to be going back soon as well. So the biggest thing that we need to remember is to continue doing the things that we've been recommended to do: masking, distancing, and good hand hygiene and washing. Those things are the primary things, especially masking in the community, that are going to decrease the community transition and allow us to continue having kids in school and doing other things that we really want to get back to doing. We have to just be able to do all of these things safely so that we can begin to learn how to navigate this new kind of world that we're in. So the other thing that goes along with that is you should begin to see that we are going to have schools that are reporting their data to the health department, and it's going to be kind of published and put out there in a little bit of a different way, just so we can kind of continue to know what's going on. We can make changes to the plans that schools have in certain areas when they're having more outbreaks. So that's going to be something that you're seeing. If you're in a school and you're administrating in a school, then I encourage you to pay attention to those things that the health department is putting out there, and the ways that you're reporting, so that we can continue to have safe plans and keep our kids in school and start doing a lot of other things as well. Let's see. So I have a couple of fun questions, I think. My friend sent me some this morning. And so the one I'm going to choose to answer is what superpower I would choose between. So I think this one came from Hannah. And she gave me the choice between the ability to fly or being invisible. And I think I've got to say, I think I would prefer to fly. Invisibility could be useful, but I think the ability to fly and transport myself a lot faster. I could sleep in a lot longer. I could eventually, when we go back to being able to visit people, be able to visit my friends and family that are far away a little bit easier. So I think I'm going to have to go with flight. So I haven't seen any other questions. I've definitely seen some shout outs, so I'm glad that people have tuned in. I hope that you guys found that information helpful. Feel free to continue sending me questions, and I'll try to continue doing these updates. I hope everybody has a good and safe weekend. Just remember to keep wearing your mask, keep your distance, and keep washing your hands. So y'all have a good weekend, and try to stay dry next week in the storms that we may see.